a case PowerPoint presentation that will be given by Dr. Ammara, who is our fellow of oculoplastic surgery, and then it will be followed by hands-on practice of harvesting of amniotic membrane. I would like to invite Dr. Ammara to give presentation. Thank you.
Thank you, sir. Assalamu alaikum. I'm Dr. Ammara Ashraf, working as fellow oculoplastic at Armed Forces Institute of Ophthalmology. I, along with my very efficient team, Dr. Waqas, Dr. Mahad, Dr. Iram, and OT staff Yasin, here to conduct a hands-on workshop on AMT preparation. Before starting, I would like to ask how many of you have prepared it? Never? Okay. The sequence of my presentation is as flashed. Amniotic membrane graft is a procedure that uses placenta to grow stem cells in deficient area. It acts as a physical barrier to promote healing, and it has antibacterial and antiviral properties which enhance its therapeutic effect. Briefly discussing the anatomy. Within the body, the placenta has two layers, chorion and the amnion. The chorion is the outer layer and amnion is the inner layer. Further describing the layers of the amnion, it has basically three layers: the epithelial layer and the stromal layer, which consists of compact layer and fibroblast layer. The stromal layer of amnion is avascular. Within the body, the placenta has outer covering of chorion, but when it is delivered, it turns itself inside out, and then the amnion is the outer layer. Before coming to the preparation of amniotic membrane graft, I would like to highlight why amniotic membrane is suitable for clinical use. First of all, it is non-immunogenic and easily available with unique structure that it has multiple growth factors. It has anti-inflammatory, anti-angiogenic, and anti-fibrotic properties. And the most important thing that as it is non-immunogenic, there are no ethical issues associated with its transplantation. Different surgical techniques which we use to apply amniotic membrane graft is inlay technique, onlay technique, and sandwich technique. In inlay technique, we basically integrate the tissue, amniotic membrane, within the defect as shown in the diagram, and it acts as a scaffold to provide corneal epithelium to grow over it. In inlay technique, we keep the epithelial side up and stromal side down of the amniotic membrane graft. In overlay technique, it acts as a physical barrier and epithelium grows below it. As shown in the picture, this is the amniotic membrane graft and the defect is underneath it. In this technique, the epithelial side is kept down and the stromal side is up. In sandwich technique, basically we combine the inlay and over technique. Now coming to procurement of placenta, you can only take placenta of elective C-section patients. किसी को idea why we only take from C-section patients? Why not those delivered spontaneous vaginal delivery? Okay, basically जो हमारे birth canal deliveries होती हैं, there is an increased chance of transmission of disease. But in C-section patients, there is a chance that disease transmission is present, but it is very less. Informed consent should be taken. Screening for hepatitis B, hepatitis C, HIV, and syphilis should be done in the antenatal period, especially in the first and third trimester. There should be absence of any kind of malignancy or infant malformation. Gestation period of at least 35 weeks. Anyone knows why why placenta is not used if it is delivered before the 35 weeks. Basically, in preterm deliveries, it is proof from the research that the amniotic membrane or the amnion and chorion is not very healthy. And there is some kind of degeneration with high level of oxidative stress, and sometimes there is infection of the membrane. That's why we don't take placenta, we don't take amnion from the placenta which delivered before 35 weeks of gestation. Transport of placenta. If you are transferring far, then ice box should be preferred. However, if the transport is within the premises of hospital, then 1 liter of Ringer's lactate is enough, or saline is enough. Now coming to the preparation of graft, the steps of preparation include separation of amnion from the chorion, then washing of the amnion, then placement of amnion on sterile nitrocellulose filter paper, and then performing the Wick test, and last is to secure with the 40 silk. This is a video showing that first you basically bluntly dissected amnion from the chorion, and you don't have to use any instrument, you just stretch the both membranes. This is the final picture. After dissecting it out, this here is amnion which is transparent and shiny, and this vascular one is the chorion. Second is the washing of the amniotic membrane. First we wash with plenty of balanced salt solution to get rid of any blood clots or any other tags. Second, we wash it with a cocktail of antibiotics. 4 antibiotics are usually used in a dose of 100 units per ml of penicillin, 50 microgram per ml of streptomycin, 80 microgram per ml of gentamicin, and 2.5 microgram per ml of amphotericin B. To prepare penicillin dose, 1 million unit of injection is used, which is diluted in 10 ml. It will give a concentration of 100,000 per ml. We take 0.5 ml of this solution and then dilute it further into 500 ml of normal saline. This will give us 100 units per ml of penicillin. Second is streptomycin. We take 1 gram injection of streptomycin and dilute in 10 ml, which will give us 100 milligram per ml. We take 0.25 ml of that solution and dilute it further into 500 ml of normal saline, which will give us 50 microgram per ml. Gentamicin is available as 80 milligram per 2 ml. We take 1 ml of that injection, that is 40 milligram per ml, and we dilute it in 500 ml of normal saline, which will give us 80 microgram per ml. Last is amphotericin B. It is available in 50 milligram concentration. We dilute it in 10 ml, which will give us 5 milligram per ml, and we take 0.5 ml of that, further dilute it in 1000 ml of normal saline, and we will get 2.5 microgram per ml. Third step is the cutting of the nitrocellulose paper. You can cut it in a square shape of size 4 into 4, or you can cut it into circular, whatever is your preference. But the important thing is that size should be adequate enough to treat at least one eye, and it should not be large enough because that will impair the storage of the amniotic membrane. I will explain this point later. Fourth is the Wick test. Wick test you can perform either with the cotton bud or with the finger, and it is basically done to find out which side is epithelial and which side is stromal. The epithelial side is usually non-sticky and stromal side is the sticky one. And it is sticky because some of the chorionic fibers are attached to it. That's why the stromal side is sticky. Otherwise, amnion itself is not a sticky membrane. Okay, this short clip shows that we are performing the Wick test with the finger to find out the side. आप लोग मुझे बताएंगे कौन सी है. एक ये वीडियो 1 है, मैं इसको दोबारा प्ले करती हूँ. एक मिनट. और ये वीडियो 2 है. Then video 2 is stromal side and video 1 is epithelial side. Then is the placement of amniotic membrane on nitrocellulose paper. We basically attach the sticky side of the amniotic membrane over the paper and then we secure it with the suture. The important thing is while placement of amniotic membrane is that it should be stretched out and not stretched enough that it creates buttonhole, but there should not be any folds. Last is that we secure the amniotic membrane with 4-0 silk suture at least 2 margins. Then is the storage. We usually store it in sterile plastic containers containing Debelco modified Eagles medium with glycerol in a ratio of 1:1. It can be stored in freezer at -20 centigrade for 6 weeks and can be cryopreserved at -80 centigrade for 6 months. These are the storage containers. It contains the Eagles medium with glycerol in a ratio of 1:1. And about the size of the nitrocellulose paper, if we made the large size graph or large size amniotic membrane, then it wouldn't be submerged in the solution and that will impair the storage of the amniotic membrane. That's why the size usually described in the text is 4 × 4 centimeter. Last is the confirmation of asepsis. We send the sample in brain heart infusion, and if it is cryopreserved, then we can repeat the HIV serology after 3 months. Okay, Procera is one of the commercially available amniotic membrane graft. It is prepared through a process of lyophilization. Basically, we freeze dry the amniotic membrane so that it becomes dehydrated, and gamma radiations are applied to get rid of infection, and then it is cryopreserved. If we see at the structure, the center contains the dried or dehydrated amniotic membrane, and this ring is thermoplastic. Basically, when we put the Procera in the eye, it has the advantage of releasing the symphlephron and inhibit the formation of symphlephron. But the problem with Procera is it is very expensive. It is almost 2 to 2.5 lakh in Pakistan. And I'm not sure it is available or not. So what we do in FIO, that we take a symphlephron ring or conformer, or we simply take the NG tube and we wrap the amniotic membrane around it and then secure it with a suture and then place it just like the Procera. Thank you. Any questions? Yes, please. If we are cryopreserving it, then we can keep it for 6 months. And some studies shows that it can be preserved till 1 year. But the problem with the preservation time is that there is loss of growth factors. So it is preferred that it should be used within 6 months period of time. Now I will request Dr. Mahad, Dr. Vakas, Dr. Iram, and OT staff Rao Yasin to kindly come forward. 3-3 का ग्रुप्स बना के आ जाएं भले आप लोग. 3-3 का डिस्प्ले. हाँ मैं बताती हूँ. First of all, the amniotic membrane is thaw if it is not freshly available, and if it is available, then the first step is to separate the chorion from the amnion. उनको बताएं कि यहाँ पे फोकस करें, मुझे नहीं, इधर टेबल पे फोकस करना है, टेबल पे फोकस करना है प्लीज़. Okay. Here we are separating the chorion from the amnion. You can see how easily it is dissected. You just have to stretch both membranes. The vascular part is the chorion and the transparent is the amnion layer. We have to preserve the amnion layer, rest of the placenta can be discarded. The thickness of amnion layer is 0.2 millimeter to 0.4 millimeter. That makes it ideal to be transplanted in the eye. This much amniotic membrane is enough for 12 to 15 grafts. Now the second step is the cleaning of the amniotic membrane. First we wash it with balanced salt solution to get rid of blood and any other tags. Then we prepare a cocktail of antibiotics. Now we are washing it with balanced salt solution to get rid of blood. Then for the second wash, we use the antibiotic cocktail present in 1000 ml of saline. The amniotic membrane is dipped into the cocktail solution. You have to use a full bottle of cocktail solution. Here we are just using a few ml, sorry. After washing it, we will check which side is epithelial and which side is stromal by doing a Wick test. The sticky side is stromal side and non-sticky or less sticky side is epithelial side. This is important because we place the stromal side on the nitrocellulose paper. The nitrocellulose paper is sterilized with ETO. We have pre-cut nitrocellulose paper. Thank you. Then after cutting it to the required size, पेपर पे पेस्ट करने नाइट्रोसेलस पेपर पे मेजो वकास उनको पेपर दीजिएगा उस पर पेस्ट करने दे दिया अच्छा After placing it, we will secure it with 4-0 silk suture at the margins of the membrane. Care should be taken that it should not fold on itself. Suture. Suture. After securing the membrane, we put it in a storage jar containing Eagle's medium and glycerol in a ratio of 1:1. Care should be taken, it should be dipped completely within the solution. This bottle contains the storage solution. Just immerse the membrane in it. Thank you so much. I will conclude by saying that this is the most cheapest available, easily available graft which can heal so many corneal and conjunctival diseases or corneal surface diseases. Thank you.